Hi, my name is Zach. I work as a physical therapist assistant, and I'm about to describe a typical day of my career. Basically, I work about 8 to 9 hour shifts a day, Monday through Fridays, sometimes on the weekends. Just depends on what the capacity of the clinic is and what's needed as a assistant as far as helping the other therapist out. Typical day, I come in, review my charts that I'm going to be working with the patients. Depends on what the patient needs, whether it's a shoulder, hip, knee, back, spine, anything that needs to be dealt with. Try to get a game plan of what we're going to do and go in from there. Usually start them off with some type of warm-up exercise, whether it's a recumbent bike or some other type of cardiovascular or stretching routine that we have for them. And then it kind of goes into there. Usually we finish up midway through with some type of range of motion, depending if it's a post-op shoulder, post-op knee, getting really hands-on with the patient and providing some manual interventions that are needed as far as the patient's needs. Some of the skills needed for a physical therapist assistant, of course you're going to need your 2-year AAS degree from either a junior college or a community college in the area. There's a lot of coursework that's specific to beginning a PTA career. You'll learn basic anatomy, different kinesiology and physiology type modalities, treatments, and specific exercises and why we do those exercises. It's not just like a trainer going into a gym and just working a certain muscle group. There's specific reasons why we're doing this for patients. Like I said, it's a 2-year degree, and there's internships within the program as you go along. The program that I was in the first year, we had a small 2-week outpatient clinic rotation where we got to observe and use a little bit of our skills that we learned the first year. After that year, we had 3 independent rotations between 5 to 6 weeks long in different career settings of therapy, acute care hospitals, nursing homes, other outpatient facilities, and other sporting event type activities, whether it was like with an athletic trainer or other therapists that work specific with sports teams in the area. Other things come along as you go along in your career. Continuing education hours come up, and specific hands-on modalities or exercise courses and much more come along into play, and that are offered through the association, the APTA. The APTA is the accrediting body for physical therapists and physical therapist assistants, and it kind of dictates what is needed in a career as far as PT or PTA goes. And for each state, there's a national board exam that's nationwide, that's same across the board. And as far as the law exams, each state's a little bit different. And there's at the end, that's the initial licensing process for becoming a PTA. Of course, everyone starts to wonder what's the best thing about a career just like this, and also the worst things. Some of the best things is I can be hands-on with patients and interacting and changing people's lives. They come in debilitated or in a lot of pain, fresh out of surgeries, and they can't do anything. And you work with them for a couple weeks here and there, maybe months, and all of a sudden, they're either back to what they could do or back to something they never were able to do before. That's one of the best rewarding things about the job, is being able to change someone's lifestyle back to the way it was or even better. Some of the worst things about it, the documentation. It's just a lot of making sure that your notes are properly worded, and make sure that what you did throughout the day is all documented and the reasons why you're doing it. Takes time to learn, but once you get it down, it's kind of one of those just meaningless tasks that you have to do, and that's probably the worst thing about the job. Final word of advice, just for anyone interested in becoming a physical therapist assistant, is to definitely do a lot of research. Make sure this is something that you want to do. Spending 2 years in a school program and finding out this is something that you don't want to do is kind of setback. Best thing to do, definitely research. Go into clinics around your area, hospital settings, nursing homes, and kind of see if you can't do some volunteer work, some shadowing, and just basically get some observation hours in and make sure this is the field for you. And and definitely this isn't like a stopping ground for you. A PTA, you can go on and do bigger and better things in school, in medical fields, and even if you decide, you know, later on down the road, this is something that you want to get out of. It's only a 2-year degree. You can always check out different like sporting teams, high schools. You can work with athletic trainers, which tie into what we do. So there's many opportunities you can do in the area to make sure this is something you want to do as far as your career, and just making sure the observation hours you're getting and the career area that you're in, whether it's outpatient